Today we will discuss about the brachial plexus as well as front of arm, cubital fossa and front of the forearm. So I already removed the skin, superficial fascia, deep fascia, and this is the pectoralis major muscles and this one is the pectoralis minor muscles. First of all, I will discuss about the brachial plexus. Here I have dissected it from the root and I already removed the clavicle, medial 2/3 portions of the clavicle I have removed. So the brachial plexus, which is emerging between the two muscles of the neck, first one is the scalenus anterior. It is anterior to the brachial plexus, and behind to this brachial plexus there is a muscles which is emerging, muscles which is lies on posterior to the brachial plexus. It is the scalenus medius muscles. So anteriorly scalenus anterior and behind to it scalenus medius muscles. In between there is a brachial plexus as well as subclavian artery which is emerging. Anterior to the scalenus anterior there is a emerging of the there is a subclavian vein which is anterior to the scalenus anterior. You have to remember. The brachial plexus, which is lies between the scalenus anterior and scalenus medius, which is formed by the fiber of the C5. Here you can see this is the C5 fiber, ventral rami of C5, C6, C7, C8 and T1. Ventral rami of the C8 and T1 united, it makes the upper trunk. This is makes the lower trunk. C7 it makes the middle trunk, and ventral rami of the C5 and C6 it makes the upper trunk. The root C5, C6, C7, C8 and T1, C5, C6 united it makes the upper trunk, C7 makes the middle trunk, C8 and T1 united it makes the lower trunk. The directly fiber from the C5, here you can see these are the fiber of the C5 which is along with the C3 and C4 fiber which is united, it makes a phrenic nerve, and this phrenic nerve which is goes inside the root of the neck, anterior to the lung and anterior to the scalenus anterior, and it supplies to the diaphragm. So the phrenic nerve which is formed by the C3, C4 and C5. So here you can see there is a contribution of the C5 fibers. Also C5, C6, this fiber root value, it is the nerve to serratus anterior. This is the nerve to serratus anterior, and the fiber coming from the C7, here you can see this is the fiber coming from the C7. All three are united and it makes the long thoracic nerve, or it is called the nerve to serratus anterior muscles. So C5, C6 and C7 fibers which makes the long thoracic nerve, and this long thoracic nerve which innervate to the serratus anterior muscles. Also here you can see these are the upper trunk. It gives the two branches. It makes the branches to the nerve to serratus anterior. Here nerve to subclavius. This is the branch to the subclavius. This is the subclavius muscle. Here you can see this is the this muscle. It is the subclavius which is innervated by the nerve to subclavius. So this nerve to subclavius supplies to the subclavius muscle which is lower. It is attached to the upper border of the first rib, and below it is above it is attached to the lower border of the clavicle inside the subclavius groove. So this is nerve to subclavius. Another branch of the upper trunk, it is the suprascapular nerve. Suprascapular nerve which is goes on the back side onto the suprascapular fossa, and which supplies to the supraspinatus and infraspinatus muscles. So upper trunk gives basically two branches, nerve to subclavius and suprascapular nerve. Upper trunk again divided into the anterior division and posterior division. Same way the middle trunk which is also divided into the anterior division and posterior division, and the posterior lower trunk, it is also divided into the posterior and anterior. This anterior division of the lower trunk which makes the medial cord, and this medial cord it gives the 5 branches. This is the first branch which is the goes inside the pectoralis minor muscles. It is a medial pectoral nerve. So this is the medial pectoral nerve. Another branch which is goes inside the cutaneous distribution of the medial side of the arm. It is a medial cutaneous nerve of the arm. So this is a medial cutaneous nerve of the arm. This is the axillary vein. I have cut it, so I will put it on the sides. So medial cutaneous nerve of the arm, which is supplied to the medial side of the arm. Another nerve, it is a medial cutaneous nerve of the forearm. This medial cutaneous nerve of the forearm, which innervate to the medial side of the skin over the forearm, and it is along with the basilic vein. So this is the cutaneous distribution on the medial side of the forearm. It is a medial cutaneous nerve of the forearm. This is the medial cutaneous nerve of the arm. This is the medial cutaneous nerve of the forearm. This is the medial pectoral nerve, and the largest branch of this nerve, it is the ulnar nerve. Ulnar nerve with the superior collateral artery. It goes behind to the medial epicondyle. It goes behind to the medial epicondyle, and it mainly supplies to the muscles of the hand. And last branch of the medial cord, it is the medial root of median nerve. Medial root of medial cord, which is attached with the lateral root of lateral cord, and it forms the median nerve. So this is the median nerve. Here you can see this median nerve, which mainly supplies to the muscles of the front of the forearm, as well as it supplies to the muscles of the thinner, except flexor carpi ulnaris, which is supplied by the ulnar nerve, and medial half of the flexor digitorum profundus, which is supplied by the ulnar nerve. So this is about the branches of the median nerve. Here I will show you. This is the posterior cord. This is the posterior cord, and the posterior cord, which gives the 5 branches. You have to mnemonics remember the ulnar. The first nerve of the posterior cord, it is the upper subscapular nerve. So here you can see this is the first nerve. It is the upper subscapular. This is the upper subscapular. After that, this nerve, it is the lower subscapular. This is the upper subscapular, which supplies to the upper portion of the subscapularis. This is the lower subscapular nerve. After that, it gives the branches to the nerve to latissimus dorsi. This is nerve to latissimus dorsi. This is the axillary nerve, which goes inside the quadrangular space, and this nerve, which goes inside the spiral groove along with the profunda brachii artery. So this is the radial nerve, and radial nerve always goes along with the profunda brachii artery. So here you can see this brachial artery. It gives the branches along with the radial nerve. It is a profunda brachii artery. So these are the 5 branches of the brachial plexus of the posterior cord. I already discuss upper subscapular, lower subscapular, nerve to latissimus dorsi, axillary nerve, and radial nerve. So this is a radial nerve. So these 5 branches of the posterior cord. Posterior cord, which is formed by the all 3 division of the posterior division of the all 3 trunks. It makes the posterior cord. Here you can see this is a lateral cord, which is formed by the lateral cord, which is formed by the this is the anterior division of the middle cord, anterior division of the middle cord, and this is the anterior division of the upper cord, which forms the lateral cord, and lateral cord gives the branches. It is a lateral pectoral. This is a lateral pectoral nerve. Another branch, it is a this is a musculocutaneous nerve. This musculocutaneous nerve pierces to the coracobrachialis. Here you can see it pierces to the coracobrachialis. It supplies to the coracobrachialis. Before it supplies to the coracobrachialis, it gives branches to the shoulder joints. After the pierce to the coracobrachialis, it supplies to the biceps muscles. After that, it supplies to the brachialis muscles. This is branches to the brachialis. It passes between the biceps and brachialis. Then it becomes lateral to the tendon of the biceps tendon. Here you can see this is a lateral to the biceps tendon along with the cephalic vein. This is a cephalic vein, Along with the cephalic vein, it is continues as a lateral cutaneous nerve of the forearm. Lateral cutaneous nerve of the forearm. So these are the three branches. One is the lateral pectoral. This is the musculocutaneous and lateral root of lateral cord, which is united with the medial root of medial cord, and it makes a median nerve. This is the median nerve. Now this is about to the brachial plexus. This is the axillary artery. Axillary artery, which is start from the outer border of the first rib, and it is end at the lower border of the teres major muscles. Axillary artery gives the 6 branches. First branch, it gives the superior thoracis. Here you can see this is a superior thoracis into the upper part. It supplies to the upper 2 intercostal space. Second branch, it is the acromiothoracis. Acromiothoracis, which divide into the 4 branches: acromial branches, pectoral branches. It gives the deltoid branches and clavicular branches. So it divide into the total 4 branches, and it supplies to the according to the name. Third one is the lateral thoracis artery. This is the lateral thoracis, which goes on the lateral wall of the thorax, and it supplies to the lateral wall of the thorax as well as the mammillary glands. The third part of the axillary artery, distal to the pectoralis minor, it is the first largest branch. It goes along the posterior wall. It is the subscapular artery. This subscapular artery, it gives the circumflex scapular. Here you can see this is the circumflex scapular artery, and this is the continuation of the subscapular artery. It supplies to the muscles of the back muscles of the shoulder region, mainly the subscapularis, latissimus dorsi, and teres major and minor muscles. Another 2 branches of the brachial axillary artery, it is the anterior circumflex humeral and posterior circumflex humeral. This is the axillary nerve along with the posterior circumflex humeral, which is passed inside the quadrangular space. So this is a quadrangular space, above by the teres minor, below by the teres major. Medially, there is a long head of triceps muscle. Here there is a long head of triceps, and laterally there is a shaft of humerus. So this is the quadrangular space, and these are the 6 branches of the axillary artery. We already discussed the muscles of the front of the arm. This is the biceps muscles. This is the bicipital aponeurosis, which is inserted inside the deep fascia, while the tendon of the biceps, which is inserted on the posterior side of the rough part of the radial tuberosity. So this is a tendon of the biceps which is inserted into the radial tuberosity. You have to remember inside the arm the median nerve, which crosses from lateral to medial side of the brachial artery. Initially it is lies lateral to the brachial artery, and it is crosses from lateral to medial sides. So inside the cubital fossa, most medial structure, it is the median nerve. After that there is a structure, it is called the brachial artery. After that there is a biceps tendon, and later on you can see this is the radial nerve. Radial nerve inside the cubital fossa, which is divided into the 2 main branches. Here you can see this is the superficial branch of the radial nerve, and this is a deep branch of the radial nerve. This deep branch of the radial nerve, which is pierced to the supinator muscles, and it supplies to the deep muscles of the back of forearm. So radial nerve, you have to, in short, you have to remember it is which is emerging from the lateral intermuscular septum, and it divides inside the cubital fossa into the 2 main branches, superficial, and there is a deep branches. Superficial branches which supplies to the superficial muscles of the back of forearm, while the deep branches which supplies to the deep muscles of the forearm. Cubital fossa, which is formed by the roof, which is it is in front of the elbow. It is the roof. It is formed by the skin, superficial fascia, deep fascia, and there is a bicipital aponeurosis, and there is a median cubital vein, which is formed by the roof of the cubital fossa. Medial boundary of the cubital fossa, which is formed by the most medially attachment of the pronator teres. So lateral border of the pronator teres, it is the medial boundary of the cubital fossa. Lateral boundary of the cubital fossa, which is formed by the brachioradialis. Medial border of the brachioradialis, which forms the lateral boundary of the cubital fossa. Apex, it is the meeting point of these two muscles. Base, you have to draw the transverse line from the two epicondyle, it is the base. Floor, which is formed by the two muscles, you have to remember this is the brachialis muscles, this is the brachialis muscles below to the brachial vessels, and also floor which is formed by the supinator muscles, and it is pierced by the deep branch of the radial nerve. So this is about to the cubital fossa. The content of the cubital fossa, most medially there is a median nerve, after that there is a brachial artery, and this brachial artery which is divided into the two terminal branches, one is the radial artery and one is the ulnar artery. Ulnar artery, again it gives the common introosseous, and common introosseous it gives the introosseous recurrent as well as anterior introosseous artery and posterior introosseous artery. Here you can see this is the anterior introosseous artery and this is the posterior introosseous artery. So this is the posterior introosseous, this is the anterior introosseous artery, and this is the continuation, it is the ulnar artery. Ulnar artery passes deep to the pronator teres, and it is goes on the medial aspect, and it is come out into the upper 1/3 part. It is deep, but into the lower 2/3 part it is superficial along with the ulnar nerve. Here you can see this is the ulnar nerve. The radial artery, here you can see this is the radial artery along with the radial nerve, superficial branch of the radial nerve. Radial artery also gives the radial recurrent. This is the radial recurrent branch of the radial artery, and this radial recurrent, which is anastomosis with the anterior descending branch of the profunda brachii artery. Now we will discuss about the anastomosis around elbow. Radial recurrent, it is a branch of radial artery, first branch of radial artery, radial recurrent and anterior descending from the profunda brachii artery, which is passes along with the inside the radial groove. This is the profunda brachii artery. So this profunda brachii along with the radial artery, it gives the anterior descending, which is anastomosis with the radial recurrent. And the one branches which is coming from the common introosseous, it is the introosseous recurrent, anastomosis with the posterior descending artery. On the medial aspect of the elbow, here you can see there are this is the ulnar artery, and this ulnar artery, it gives the two branches. One branch is here. I will just cut the radial bicipital aponneurus for the better visualizations. Here you can see this is the radial artery. It gives the two branches. Ulnar artery, it gives the two branches, anti-ulnar recurrent, and this is the artery which is goes posteriorly. It is the posterior ulnar recurrent. Anterior ulnar recurrent, which is anastomosis with the inferior ulnar collateral branch, which is emerging from the brachial artery, So this is the inferior ulnar collateral, and superior ulnar collateral. This is the superior ulnar collateral which is goes deep, and it is goes on the back side, and it is anastomosis with the posterior ulnar recurrent. So this is the ulnar artery. Here you can see this is the ulnar artery, this is the anti-ulnar recurrent, and this is the artery which is on the back side. It is a posterior ulnar recurrent. So it makes the anastomosis anterior ulnar recurrent in front of the medial epicondyle, which is an anastomosis with the inferior ulnar artery, inferior ulnar collateral artery, and superior ulnar collateral artery. It is the branch. Both are the branches of brachial artery, which emerging on the upper side, and posterior ulnar collateral, which is anastomosis with the posterior ulnar recurrent branches of the ulnar artery. So this is the anastomosis about the elbow joint. Muscles of the front of the forearm. This is the first muscles, which is from all the flexor muscles of the forearm, which is emerging from the medial epicondyle. It is a pronator teres. Pronator teres, which is pierced by the median nerve. Here you can see these are the branches of the median nerve. Median nerve, which is at the elbow, it is only gives the branches to the pronator teres, remaining all the branches which is emerging inside the forearm. So first muscle, it is a pronator teres. Second, on the radial side, over the thumb side, it is a flexor carpi radialis. Small muscles, pronator teres. Below to it, there is a flexor digitorum superficialis, and most medially flexor carpi ulnaris. Deep to it, there is a three muscles. On the ulnar sides, there is a deep muscle, it is the flexor digitorum profundus. And on the radial side, there is a deep muscle, it is the flexor digitorum, flexor pollicis longus. And deep to here, there is a one muscle, it is the pronator quadratus. These are the 8 muscles. All the muscles are supplied by the median nerve, except flexor carpi ulnaris and medial half of the flexor digitorum profundus. The tendon which goes inside the little finger and ring finger, it is supplied by the ulnar nerve. So this is about to the front side of the front of arm and front of the forearm, as well as the brachial plexus and axillary artery, as well as here you can see this is the brachial artery. Brachial artery, which is start from the lower border of the teres major, and it is terminated inside the cubital fossa by the radial and ulnar artery. Brachial artery, it gives the branches to the inside the cubital fossa. It gives the first branches. It is a profunda brachii artery. After that, it gives the branches at the muscular branches. It gives the superior ulnar collateral, inferior ulnar collateral, and 2 terminal branches, radial artery and ulnar artery. So always you have to remember brachial artery initially inside the upper part of the arm, which is lies medial to the median nerve, but into the lower part it lies lateral to the median nerve, and it is passes between the biceps and brachialis muscles. So this is about to the brachial artery. Hope you enjoy the lecture in details. Thank you very much.